officers, public press who are joining us online. So, as in the usual way of things, keep yourself on mute. Don't accidentally press the speaky button. And if you want to attract attention by waving when you want to speak, and introduce yourselves at that point.
Department for Education, but a lot of other partners are bought into this, including loads of local councils and a lot of private industry, a lot of private commerce. It is there to enhance our current offer to our care leavers. So if we go ahead with this, there'll be instantly over 250 people who can access the care leaver covenant, and that will be done by using an app on your phone. And what it can give you support in terms of education, training, employment, finances, loads of different forms of support that you can get access to, as well as I understand sort of they'll alert you if there are any particular jobs that come up, so you can apply directly for jobs. The key outcomes that we're looking for our young people are better advice around living independently, improved access to employment and training, better stability in their lives so they feel safe and secure, improved access to health support, and they achieve financial stability. So it's a great scheme. I'm quite happy to propose this to the council, and I'm sure that my two colleagues, Vicky and Sarah, will have something to say on this. Thank you.
Thank you, Councillor Hobson. Totally agree. Vicky and Sarah, did you wish to add, make some comment? Thank you.
Good evening. Councillor Hobson's given a really good introduction actually to the Care Leaver Covenant. As he says, we're seeking support from the executive to join the Care Leaver Covenant. I'm going to hand over to Sarah McCartan, who's our Head of Service for Care Leavers, just to tell you a little bit more about some of the outcomes that we're hoping to see. Thank you.
Thank you. As Councillor Hobson has said in the introduction, it's a centrally funded initiative. It's part of a national inclusion programme from the Department for Education, and it's designed to create more meaningful opportunities for our young people. These opportunities will be across the public, private and volunteering sector, and will already enhance our current offer for our care experienced young adults. The Covenant will provide different kinds of support to what is already available to our young people locally. These could be work placements, internships, mentoring, finance guidance, careers coaching, as well as discount access to leisure, sport and retail offers. The opportunities will come from organisations of all shapes and sizes, and current membership of the Covenant includes global media companies, national law firms and government departments. The recommendation, and what we're here to seek from the executive, is approval first to join the Care Leaver Covenant as a council, and secondly for the executive to recommend to our council wholly owned companies who are not already members that they should actively sign up and support the Covenant and the children of our town.
Thanks very much, Sarah. Does anybody have any questions? Councillor Benson?
Thank you, Chair. Yeah, fully supported of this scheme. We're all corporate parents and we have a duty to look after our care leavers just as we would look after and support our own children. Thank you.
Yes, absolutely. It's not just a legal responsibility, it's a moral responsibility, and it should be no more, no less than we would wish for or endeavour to deliver in terms of opportunities for our own children. Councillor Hobson's recommended. Can we have a show of hands to approve?
And that's carried.
Thank you very much. Thank you, Sarah and Vicky. So, agenda item... I've lost myself now. CCTV, which is Councillor Brooks.
Yes, thank you. I think it's important to say that CCTV plays an important role in public safety and confidence, particularly in relation to accessing the town centre at night. The current core system, town centre, promenade and key locations within the borough actually require upgrading from the old analogue to new internet protocol technology to make way for the new central development. To make way for the new central development, the existing control room, which is housed in Bonny Street, needs to be moved to a new location, and the proposal is to move it to the basement of the municipal buildings. As part of the review of the CCTV, we've also identified the need for a mobile CCTV unit, which can be used in hotspots, events and in potential emergency situations. I think it's important to say that it's referred to in the report, but in considering the replacement of the system, which covers mainly the town centre, from the promenade to the Metropole and Sandcastle, other key locations within the borough, and the control room relocation, we've actually consulted quite widely in advance of publishing the paper. In fact, unusually, we've actually had a scrutiny review panel already contribute to the discussion. We've had discussions with the police, counter-terrorism, fire, ambulance, event management, emergency planning and business improvement district have all been involved in those discussions, because it is a really important issue for us going forward. Significantly, £2 million of investment is a big investment that needs appropriate consultation as well. Essentially, the core system will see an increase in cameras from 92 to 346. The cameras will have 360-degree vision. There'll be movable cameras on each column and 4 statics. In addition, there's going to be 32 public address. The current 32 public address speakers we've got will be increased to 105, which in terms of an emergency situation will have the potential to warn and inform. And basically what that means is that if we're trying to get people away from an area, we'll be able to talk to them through the CCTV columns. Equally, if we see antisocial behaviour, we'll be able to point out to people that they are on CCTV. And it might not be such a good idea to do what they're doing. So I think that's an important development as well. The control room at the municipal building, where public protection staff are based, will result in many also being trained to access the system, adding to the capacity of the existing staff. And it'll also be an ideal control centre for larger events, something we don't have at present. And with the additional facilities, we can also have it as an incident coordination centre, which has been warmly welcomed by the Counter-Terrorism Security Advisor and Emergency Services. The real game changer in terms of liaising with the police is that currently the CCTV cameras, if we see something on the cameras, antisocial behaviour or whatever, the police require pictorial evidence. We actually have to download a disc, and it could take sometimes days to get that disc produced and submitted to the police and possibly used in evidence. Once this system's up and running, the police will be able to access it in real time. So instead of waiting for several days to decide whether to charge somebody, they'll literally be able to do it while they're in the cells. So, you know, it'll be not, we'll release you pending further investigation. A decision can be taken there and then, which is better for all concerned. The estimated cost I've already mentioned is £2 million, which will be met from the self-insurance reserve, and a contribution has been received from the major town centre investments and developments. In addition, the proposal is to include £100,000 in the mid-term financial plan to ensure the service has an appropriate revenue budget going forward, which is something the Audit Committee has expressed concerns about. We've already got £200,000 from the proceeds of crime that's been acquired by Trading Standards, and that's currently being used to upgrade the CCTV systems in Ankersholm Park and Stanley Park. So that's briefly it. All I need to do is to recommend the paper, the recommendations at 2.1 2.4. Don't know whether you want me to read them out. Is that necessary? Well, I'll formally move recommendations 2.1 to 2.4, and hopefully we can get the show on the road, as it were.
Right. Thank you very much, Councillor Brooks. I know that John Blackledge was with us. Did you want to add anything further?
Reinforce what Councillor Brooks has said. We've been through an extremely robust process involving all key partners and carried out due diligence in relation to this in many ways. It really is a positive way forward for CCTV in terms of building a system fit for purpose and contributing to the safety and security of our town in many ways, and future-proof in terms of developing and adding to in the future. So it's very positive for the town.
Great. Thank you very much, John. Does anybody have any questions? Councillor Campbell?
Not a question as such, Leader. Just to say on a personal level how pleased I am to see this. I spoke with John about it the other day there. We started this when I was the Deputy Leader looking at this scheme, and it's really nice to see it come to fruition, and I think Paolo Pertica would be very proud. Thank you.
Thank you. Thank you for that, Councillor Campbell. I agree. I think, yeah, it's a great scheme, and, you know, I think all the work that's been, you know, inputted into it to ensure that we come out that it's, you know, absolutely supported, and I think we can just move on to agreeing the recommendations from Councillor Brooks. Are we all happy with the recommendations?
That's agreed.
Thank you. Agenda item 4, which is the investment in the town centre, Adelaide Street Health Centre. I believe Steve Thompson, you're going to say something about this?
Yes.
Are you there?
This report is the culmination of several months collaborative working and negotiating with our health colleagues who have difficulty raising finance and actually owning assets. It's part of the constitution that CCGs cannot own their assets, so we work with them. That's with the CCG, the GP practices and NHS Property Services to look at planning, building this £8 million development that will consolidate two general practices within the town of Adelaide Street and South King Street, and a pharmacy. It will be a 32-year lease, and at the end of that, there will be a consideration of £1 to transfer that asset back over to health. There is planning permission already in place, and it will provide a wonderful health facility in a part of town where it's absolutely needed.
Yes, absolutely. Thanks, Steve. Yeah, I move the resolutions at 4.1 to 4.7. It will provide the community with great facilities and improve access to health, which is particularly needed in that area of the town. So could I have a show of hands to support the resolution?
That's agreed.
Thank you very much. And then lastly, it's Steve again. Item 5, financial performance monitoring as at month 3.
Yes, this is the first quarter's report, and on the face of it, it's not a good one. We're showing forecasting a 6.6 million overspend, which basically eradicates all the working balances that we brought forward. Now, £3.5 million of that is COVID-related spend. So, having incurred a pressure last year of 3.2 million related to COVID, we're looking at a further 3.5 million this year of basically COVID-related consequences and services that are not reclaimable or grant funded from central government. So we will continue to lobby government in this regard. Really, the other areas of overspent, well, children's is about 2.8 million. Numbers of looked after children are actually at a level below 600. It's the first time for 21 months. September 19 it was. But just looking at the residential unit price over that period, there's been an increase of 25% over 21 months, which is a staggering price increase and probably represents the market, but also the escalation and the breakdown of high cost placements, escalation upwards. So that is a concern. Also on adults, although that's only showing an overspend of 300,000, there is an underlying pressure there that's being disguised by the COVID funding support, which will eventually end. And in the main has resulted from earlier discharges from hospital with more complex cases. And it's interesting looking at the activity over the last 2 years between 2019 and 2021. We've seen domiciliary care hours actually increase by over 50% during that period. And even packages of care have increased by 21% between pre-COVID and now. So some staggering demographic pressures there in the care sector. Elsewhere, as positive reports on our wholly owned companies, we started the year back in month 0 looking at 5.6 million losses across all our companies. By month 3, that dropped to 4.5, and that trajectory is continuing. And that's because of better than anticipated expected trading here in the town and more clarification on government support, particularly with the transport company. And lastly, in relation to our income collection, council tax and council tax reduction scheme are a tad up year on year, which is encouraging. Business rates is the reverse, but it's based on a much smaller collectible. And from months 1 to 3, a number of retail, hospitality and leisure businesses in the town received 100% relief. That drops to 66% from July through to March. So it's not a great position, and it's probably a very optimistic one, I would say, at this point. But it's quite apparent local government is in a difficult place with the consequences of COVID and demographic and demand pressures. Only today, Derby City Council, it was announced that an £11 million budget gap was emerging, and I suspect that will be one of many as the year progresses.
Thanks, Steve. And does anybody have any questions or points you wish to raise? But yes, and I mean, we need to thank you and your team for all the work that continue to do over the last 18 months. And obviously the issues continue, but thank you very much for those detailed comments in the report. So if I can move the recommendation of the resolutions at 5.1 to 5.5.
Again, that's agreed.
Thank you. And we're done. End of the meeting. Thank you all very much. Good night.